Good day, everyone. Today, we will be exploring the different models for evidence-based practice in nursing. Our discussion will cover what evidence-based practice is, its importance, how to use these models in various settings, and a brief overview of each model. Let's dive in. First, let's define evidence-based practice, or EBP. EBP in nursing is the conscientious use of current best evidence in making decisions about patient care. This approach integrates clinical expertise, patient values, and the most relevant research evidence to improve outcomes. Essentially, EBP ensures that healthcare practices are grounded in solid evidence rather than tradition or anecdote. Now, why is EBP so important? There are several key reasons. Better patient outcomes. EBP leads to improved patient safety and healthcare quality. By using the best available evidence, we can provide care that is more effective and reliable. Cost-effective and efficient care. EBP ensures that care is based on the best evidence, which often leads to more efficient use of resources and reduces unnecessary interventions. Staying current. EBP helps healthcare professionals stay up to date with the latest advancements and practices, ensuring that patients receive the most current and effective care available. How to use EBP models in different settings. EBP models provide structured frameworks that guide the implementation of evidence into practice. These models can be used in various healthcare settings, including hospitals. Develop protocols and procedures to enhance patient safety and outcomes. For example, implementing evidence-based protocols to reduce infections. Clinics. Adopt best practices in treatments and interventions to enhance patient care. For instance, using the latest evidence to manage chronic conditions like diabetes. Community health. Address public health concerns and implement preventative measures based on evidence, such as vaccination programs or health education initiatives. Educational institutions. Train future healthcare professionals in the principles and practices of EBP, ensuring that the next generation of nurses is well-equipped to provide high-quality care. Now, let's briefly describe each of the key EBP models. The Iowa Model of Evidence-Based Practice. This model is a systematic approach starting with identifying a problem or opportunity for improvement. It involves forming a team, gathering and appraising evidence, piloting the change, and evaluating outcomes. Example: reducing catheter-associated urinary tract infections by implementing aseptic techniques. The Johns Hopkins Nursing Evidence-Based Practice Model. The PET process of this model involves three main steps: practice question, evidence, and translation. It guides nurses in developing a practice question, searching for and appraising evidence, and translating findings into practice. Example: improving patient fall rates by implementing evidence-based fall prevention strategies. The Stetler Model of Research Utilization. This model focuses on how individual practitioners can use research. It includes 5 phases: preparation, validation, comparative evaluation and decision-making, translation and application, and evaluation. Example: integrating new pain management techniques for postoperative patients. The Perry's Framework. Promoting action on research implementation in health services. This framework posits that successful implementation of research into practice is influenced by evidence, context, and facilitation. It emphasizes the importance of these elements for effective practice change. Example: implementing a new protocol for hand hygiene compliance in a hospital. The ACE-STAR Model of Knowledge Transformation. This model describes the process of knowledge transformation through 5 stages: discovery, summary, translation, integration, and evaluation. It focuses on how research findings are converted into practice. Example: improving wound care practices in a nursing home by translating research on pressure ulcer management into clinical guidelines. The Ottawa Model of Research Use. This model emphasizes the influence of the practice environment, potential adopters, and implementation strategies on research use. It helps identify barriers and facilitators to using research in practice. Example, implementing a new protocol for sepsis management by assessing the readiness of staff and the organizational climate. By understanding and applying these models, healthcare professionals can systematically integrate research into practice, leading to improved patient care and better health outcomes. Thank you for watching. Please do not forget to like, share, and subscribe to this YouTube channel for more videos.